Welcome to Teaching Taboo Topics, Mental Health Issues and Aging, presentation on hoarding in older adults, not just a crazy cat lady. I'm Pamela Pittman Brown. I'm an assistant professor of sociology at Albany State University in Albany, Georgia. And this is our 7th year, I believe, presenting Teaching Taboo Topics. I hate that I'm not with you today. Unfortunately, I am undergoing cataract surgery and was unable to attend the conference, but I hope that you'll enjoy the presentation just the same. So this presentation focuses on introducing students to multiple causes of hoarding behavior, and it's actually addressed via an activity linking photos, videos, cases to research. While students may be familiar with hoarding via popular television series such as Hoarders, Hoarding, Buried Alive, and Confessions Animal Hoarding, they may be unfamiliar with the mental disorders which cause older adults to hoard, which include dementia, obsessive-compulsive disorder, senile breakdown or Diogenes syndrome, major depressive disorder, schizophrenia, psychotic disorders, cerebrovascular disease, or autism spectrum disorders. Now, when we are talking about hoarding or a collection, one thing is collections. The general concept of collections is that the collectors have a sense of pride and they experience joy in showing or displaying their collections. And many times the collections are simply organized for display. So things have a place. The area is clean, it's organized, and it's not tossed in a pile or haphazard for collections. When we are looking at hoarding, usually hoarders experience embarrassment about their possessions, and they feel uncomfortable when others see their possessions. Normally we would just consider it really cluttered, very messy, and detriment to their health. It may also be at the expense of livable space. They may feel sad or ashamed after acquiring additional items, and many times what we find is that the hoarders are also greatly in debt. So in this slide, I just wanted to posit the difference between what we would see hoarding on the left from a book collector or a magazine or newspaper collector, and someone on the right who has a beautiful display of their books, who takes care of them, who shows pride in them, and is happy for others to see their collection. I would assume that the person on the left would be very frustrated and very unhappy if someone had come in and saw their book collection. Also, if you notice on the left-hand side, you see bookcases that appear to be tilting or falling on the off the wall, or where books are just stacked up and there's no organization to it. So a person would be unable to locate a particular book or be able to find it. This also causes a lot of embarrassment and it upsets the individual greatly. Facts of hoarding is that approximately 2 to 6% of the population have hoarding disease, or hoarding disorder. So when we are talking about the hoarding disorder, it is now listed in the APA DSM-5. What we know is that it is at least partly genetic and biological, as the regions of the brain that are associated with hoarding appear to be the anterior cingulate cortex, which aids in assigning emotion and motivational salience and experience. The ACC activation is lower in hoarding individuals per the PET and the fMRI. So one thing that we also know is that, while it might also be genetic and biological, we're not sure in some cases where this is an environmental contact, as far as persons who grew up with hoarders. Do they eventually hoard, and how does that operate as well? So some of these things are still under consideration and are still being investigated. While we tend to look at approximately 2 to 6% of the population having hoarding disorder, when we look at it from a perspective of gerontology, one of the things that we might want to consider is that if it's approximately 2 to 6% of the population, and a lot of times it is older adults, what is that telling us about the sheer number of older adults who are involved at some level of hoarding? So the DSM-5, the diagnostic criteria for hoarding disorders, I have taught a class where I have actually just given this to the students, and then we've gone over it because it makes a lot of sense if you look at it. That, one of the aspects sometimes that we talk about through life course is that we used to think about this, that hoarding was really based on a desire and a difficulty or a perceived need to save the items, and for those of us that have a junk drawer at our home, it might be bread ties, or it might be rubber bands or something like that. I grew up in a house where everything was extremely neat and orderly, mainly because my father was an OCD compulsive cleaner. However, one thing that he could not do was throw away a rubber band or a bread tie. So we had hundreds of bread ties and rubber bands in our junk drawer. Now, that was very convenient when you needed a bread tie or a rubber band, but it was also very aggravating. Now, the good thing is that he did clean those out occasionally, and so we would start over. But this is totally different in that this difficulty is due to a perceived need to save the items, and it causes distress. So they cannot just discard the item. It causes them great distress. Now, also with that, the possessions, discarding possessions, it results in an accumulation of possessions that congest and clutter active living areas and substantially compromises their intended use. So, as a person who also grew up with people who were born during the Depression, one of the things, I had an aunt who just could not get rid of antique furniture, or so it was her perception that it was all antique, and thus it was very important. So in her living room and dining room, she had 3 sets of bedroom furniture. Now, that was very interesting. Because we didn't talk about it. Now that I look back on this, I go, wow, that was really just weird. But, at that point in time, it was neat and clean, but it was cluttered, and it compromised the use. So, we had to work around the 3 bedroom suites that were in the living room. And I always laugh and say, so I got used to having conversations sitting on a bed. It was very weird as a kid. But then, this again, the hoarding is not attributed to another medical condition. Now, this is part of hoarding disorder, that the hoarding is not attributed to another medical condition. So while we might think of the person being a hoarder to meet, and that it might be from a mental disorder, one of the things is we really have to look at this as separate. So while we might consider all people who have hoarding, who are hoarders, have some type of medical condition, and that or have a mental disorder, one of the diagnostic criteria for hoarding disorder is that the hoarding is not explained by the symptoms of another mental disorder, or not attributed to a medical condition. So I think that this is a key component is that if there is no mental or medical condition that the DSM does not recognize the diagnosis as a hoarding disorder. So now let's look at the mental disorders and hoarding and the research that talks about the hoarding within mental aspects. So we have anxiety and depression. We have dementia, which persons, if you have worked with dementia patients, you will see, or Alzheimer's patients, a lot of times you'll see hoarding of food, maybe crackers or packets of Splenda, packets of coffee, packets of tea, several things like that, and that actually we know that there is a problem a lot of times where people have dementia or have early signs of dementia because we're seeing them actually collect packets of sugar or packets of tea or packets of coffee or crackers, or even if you go into McDonald's or Wendy's, you will see persons getting tons of straws, ketchup. It's actually a very interesting phenomenon to watch. Obsessive compulsive disorders. So this might also play into some of the mental disorders and the hoarding, where perhaps something starts out as a collection and then it escalates. We also have Diogenes and senile breakdown. Now, senile breakdown and Diogenes syndrome is a very interesting aspect where one of the things that we talk about is squalor and severe self-neglect. This is really a aspect of where someone has gone, not just where they're neglecting to take a bath, but where they are living in just absolute filth. Now, one of the things that we do know about Diogenes syndrome and that we do understand a little bit about it, but one of the things that we have seen is the aspect of the level of poverty that was within childhood, or the aspect of living with very little, or also living with people who had severe issues, and so therefore the home was not as clean. But that's not always 100% accurate. So we also find people who have other types of mental breakdowns that exhibit this form of breakdown, and also people who are very intelligent have been known to have senile breakdown or Diogenes syndrome. We know that people who have schizophrenia and have psychotic disorders also can move into hoarders, as well as cerebrovascular disease and some of the autism spectrum disorders. So you cannot have the DSM hoarding disorder if you have any of these mental disorders. Now, this activity I have done on a limited basis, and what this does is it's a video case study that links to the research on hoarding, and the activity consists of looking at video case studies, and what we would use would be television shows such as Hoarders, Buried Alive, Confessions of Animal Hoarding, and actually you can even pick up some of this within American Pickers and Strange Inheritance. So it's a kind of an interesting time that we are in, where we have the availability to really peer into persons who hoard and peer into their life and kind of use this as studies for our students, whether they're gerontologists or whether they're social workers. I think that this really relates to both of those professions quite well. So let's move into what we do within our video case studies. So one of the first things that I do is I ask the students to go and I want them to look through some of the episodes of Hoarders. And I also want them to find an older adult or a person over 50 who, and a lot of times during hoarding and hoarders, they will tell you the age of the person and their name and their information and everything. So that really kind of helps. So what I've done is I've kind of created a worksheet for the case study, and I want to know, first of all, I asked them for the link of the video, which is within the worksheet, and then I refer to these people as an individual or a client, because when we're doing an intake, whether we're gerontologists, whether we're sociologists, whether we're social workers, whether we're nurses, we're looking at it from a patient or a client perspective. And so this is really important to not call the person a hoarder, but to consider them an individual or a client. And so it gives them a name. It's a little bit easier for us then to work through. Then the next thing that I want to know is, what are they hoarding? So I want you to tell me, what is this person hoarding? Are they hoarding trash? Did it appear that it really started off as a collection? Are they hoarding animals? Now, then once we do is we start looking at some of the other aspects within client evaluation or an intake, where we would say, is this individual in danger of losing their home or their family due to this hoarding behavior? Are they a homeowner or a renter? How long has the person been in the home? And so a lot of times the information that we would be gathering as a client actually from a client is actually located within the video. Maybe that we have to tease it out and we have to really listen to the video several times to catch some of this. And then again, some of the videos never really address it, but a lot of times they will talk about that they're in danger of losing their home, or they're going to have to go to a nursing facility, or their family, their children are being taken away from them, or some of those dynamics. Now, we also ask about, are others living in the home with the individual or the client? And a lot of times that might be, that a spouse is living there, or maybe the spouse is giving them an ultimatum, or there's children who are involved, maybe an older child has come in, but sometimes it's also a court system that has been involved. So it might be Adult Protective Services has been called based on the fact that maybe some persons have seen the condition of the home and have reported it to Adult Protective Services, or have reported it to child welfare. It might also be considered a public health nuisance or a public health hazard, and animal control. So if there are a lot of feral cats or dogs, or inside or outside, animal control might also be called. Now, one of the other things that we want to know is, does the individual have Alzheimer's or other related dementia, or is any of that even mentioned within the show? So sometimes the mental health or the Alzheimer's or other related dementia is brought up within the video, so that way we know what is going on. Well, here again, just a continuation of the worksheet, where we're asking, I'm asking the student to assess the condition of the home. Now, one of the things that I include is also a clutter image rating scale, or clutter hoarding scale, and I'll show you the clutter image rating scale in just a second, but also then some of the other key things of how does the individual act when asked to declutter, to remove items, getting upset if things are moved or touched. Do other people contribute to their collection or help them store items? A funny thing is, of course, I collect owls, and so people give me owls all the time. And while I absolutely love all of my owls, one thing that I have learned is I have to say, please don't give me more owls. But I also have to say, if someone likes owls, I also give them an owl. So, I have a few that I have kept, and I have some that I have given away. And, so it's actually kind of, clearly I'm not within this, because I'm not upset. I don't cry. And, I enjoy giving giving some of my L's to other people to make them happy. Now, per the video, here's one of the other things. Does the individual state a link to when they begin collecting items? So this might be the death of a spouse. It might be a depressive episode. What happened? What has triggered? So this is the clutter image rating scale, and this shows you like the amount of clutter in your room and where does it look. Now, you can see that 1 or 2 might need just a good cleaning. It might be you were really busy. 3 looks like somebody came home and just dumped a whole bunch of crap in their floor. But then it starts really affecting the person being able to sleep. And so you can see, as you move to 9, there's no room to move around the room or to sleep. Then this is a Holmes multidisciplinary hoarding risk assessment, which I have tried to introduce to the students. So it really gives them a checklist that they can look through the video and can look to see, is there any information within the hoarding risk assessment that they can utilize. And again, just more check sheets. And then also the students are asked to turn in 3 recommendations for social workers, gerontologists, or aging services. And they have to write a synopsis of the video and include the video link for credit. They're also asked to link information to the DSM-5 if the show's experts discuss anything related to the DSM in the show. And I also want the students to link their findings from their case to research within journals or scholarly websites and publication. And so this is really the application and the linkage back into what we're trying to give them, to take with them a tool and a skill set that they can build from. So here are just the link to some of the materials that I've used and any of my references. And if you have any questions, I'm sure Hallie or someone could give you my email, and of course I would be happy to talk with you or email you a copy of my slides. Also want to do a little plug here for 2017, going to Atlanta, Georgia. So I look forward to seeing all of you there, and thanks a lot.